Brain cancer is a tough disease, and one of the most aggressive types of brain cancer is called glioblastoma multiforme, or GBM for short. The tumor is generally radiation and chemo resistant. It's also the #1 cancer killer in children. And only 3% of patients survive beyond 5 years. This disease puts a very high emotional and financial burden on the affected family. LeadInvent Pharma is developing a breakthrough treatment modality that will improve GBM patient survival via a uniquely designed nanotechnology-based gel called GBGel and photodynamic therapy, or PDT. When a photosensitizer is exposed to the laser, it produces hyperreactive oxygen called reactive oxygen species, or ROS. ROS kills rapidly cycling cells like cancer cells by multiple pathways. ROS is powerful enough to kill a 3D cancer cell colony also. Although PDT has received FDA approval for some oncology indications, its use has been limited because of inefficiency in treating large tumors, limited light penetration to treat deep-seated cancers, and skin photosensitivity, requiring patients to stay in dark or semi-dark surroundings, sometimes up to 4 weeks. LeadInvent Pharma's GBGel overcomes these challenges while retaining the benefits of PDT. GBGel carries smartly designed nanoparticles, which are approximately 75 nanometer in size. While small in size, each nanoparticle is loaded with multiple photosensitizer molecules. When the laser light hits these nanoparticles amplify the effect of encapsulated photosensitizer and results in enhanced ROS generation. The major problem in GBM is that the tumor is embedded in the normal tissue, which makes it extremely difficult for the surgeons to completely remove the tumor without causing substantial damage to healthy brain tissue. After GBM surgery, generally, a tumor margin gets left behind. Some of these leftover cancer cells are resistant to follow-on chemo and radiation therapy, causing rapid regrowth in 90% of patients within 6 to 7 months post-surgery. And hence, survival time has remained at 15 months even after the best of treatments. GBGel can help surgeons remove these leftover cancer cells uniquely and safely. After removing the maximum tumor, the surgeon would spray GBGel into the resected cavity, depositing a fine coating of nanoparticles. Nanoparticles then permeate further, covering up to 3 centimeters area around the site of application, and are preferentially absorbed by leftover cancer cells. Next, the surgeon would place a fiber optic in the resected cavity and would deliver a lower power laser which will activate the GBGel inside the leftover cancer cells, killing them through ROS generation. GBGel has been extensively tested on different GBM cancer cells, such as primary GBM cancer cells, chemo-resistant GBM cancer cells, and radiation-resistant GBM cancer cells. GBGel not only kills primary GBM cancer cells, but also chemo and radiation-resistant GBM cancer cells. GBGel eradicates brain tumors in animals without recurrence. GBGel kills chemo and radiation-resistant human glioblastoma cells. GBGel is made from FDA-approved components. Localized application of GBGel minimizes chances of systemic toxicity. GBGel is patent protected. LeadInvent Pharma is committed to harnessing the power of nanotech and laser for eradicating brain cancer.